This virus is moving faster than Usain Bolt. I have 4 daughters. They don't necessarily read newspapers, nor do they watch television news, ever. And they're educated girls. They get their information totally from social media. How are we going to get the message through to them that as a group, women aged 20 to 29, that they have the highest number of infections? This is a really vitally important question. The highest group is 20 to 29 women.
Kerryn Phelps.
Thank you so much for that question. I think it's really important because we do have to get the message across to young people in that age group that they have a great community responsibility. They have responsibility to themselves, to their friends, to their family, to their older relatives, and to the community generally. And if they want to get their lives back on track and not face the kind of strict lockdowns that we're seeing in Victoria in the longer term, then they need to play their part. And playing their part means doing everything they can not to catch that infection. So whether that means wearing a mask when they go to the supermarket or when they're in a lift or on public transport, whether that means not going to a crowded bar, whether that means not having a party or trying to get away with something, then that's what they need to do. And we also need to get the message across that just because you're aged between 20 and 29 doesn't mean you're not going to suffer one of these serious consequences that Lucy here is talking about, because you can be young and become very sick and die from COVID-19.
But is there a problem here, and I'm interested, Lucy, in your thoughts on this, in confronting the really difficult reality of this, which would be saying to young women, you can't actually live the life that you want for quite some time, Lucy?
No, we can't live the life that we used to live. It is confronting. I guess for clinicians working every day, that's our normality. We're not working from home, we're seeing it every day. Even for all of us, there is a certain degree of COVID fatigue. It's not about forgetting to wear your masks, but it's just thinking about it constantly. And that's happening for all Australians, I suspect. Even our kids who might be at school, might not be reading the papers, they know what's going on. Yes, it's confronting. Yes, it's never going to be the same, but
how do you communicate that to a mass population? How do you say to every young person here that's, you know, possibly had to pull out of education or doesn't have a job because they just can't get one or they've lost their cafe job, you know what, with all this spare time, you can't go and have a party. You can't do the things you want.
Look, it's very, very difficult. I don't know that I've got the answers. Kerryn might have some better suggestions than I have, actually.
I think there's 2 things. One is we have to speak in the language of young people, and that means that they need to speak to each other. We also need to go to where young people are getting their information from TikTok, Facebook, wherever they are communicating with each other. We need to be going through the universities and saying, OK, university, yeah, it's really tough that you can't go to university events, that you have to do your university tutorials on Zoom for months and months, that you can't get involved in the normal kind of university debates and politics that people love going to university for. But it's also, if we get this right, it's a temporary measure. If we don't get this right, it's going to go on for much, much longer. So I think that the message to young people is if you want to nail this, if you want to help us get this under control and eliminate COVID-19 from Australia, which I believe we can do. We've done it once, went very close to eliminating it. We can do it again, but we have to commit to it, and everyone has to commit to it. And if you do commit to it, then you have a chance of being a part of that solution and of ending this period of time for Australia.
Abbey, you've been pretty prolific on the socials.
Yeah. Look, I want to agree with Kerryn completely. In targeting a younger audience, we do need to be quite strategic. I was quite vocal on Facebook. I did put a plea to the front line, I guess you'd call it, and that was because I realised that the community was disengaged and I guess not really listening to the restrictions, and the best way for me to get their attention was through Facebook. I also want to address the elephant in the room that as a young person, I want to speak to the other young people, and I want to say that this virus does not discriminate. I have been in the room when we have intubated 30-year-old people. We've put them on ventilators. We've sent them up to the ICU. They are critically unwell. So I don't want the young people of today walking around believing that you are invincible to this. You are just as susceptible. And yes, perhaps not as susceptible as our elderly, but they're our history. These are the people that we need to do the right thing for so that we can take care of them, but also ourselves. We have a community responsibility to do the right thing.
I think the other, can I mention, Hamish, that there's no doubt that older people are dying at higher rates than younger people with COVID. But as the numbers of cases go up, there will be younger and younger people. It's just a numbers game. There will be younger people who do catch this virus, and there'll be children who catch this virus.
You did speak to the longer-term implications of this. Thomas Hudson wrote into us this week from South Yarra. He tested positive for COVID. 5 months on, he still doesn't feel right. He's got shortness of breath. He experiences heart palpitations. He's got serious fatigue issues, all things that he hasn't experienced before. I know you're saying we don't have all the answers, but do we know what this can do to a young person?
Thomas's experience is similar to several patients that I've been looking after. And this prolonged fatigue, significant anxiety and depression symptoms are very characteristic. None of us, no one in the world has had enough time to have anything more than sort of 6 months of follow-up of patients with COVID-19. Even the first outbreaks, remember, are only just before Christmas, and it's only August. So we don't know what the very long-term outcomes are going to be. But certainly Thomas's experience is not unique, we clinicians are anticipating a significant burden of this infection that will go on and on, for many months, if not years to come.